So I've met Lynn at many brain injury advisory councils. I've seen her at different conferences and things like that. And I've always seen her as really an invaluable resource related to youth and concussion. Lynn is a licensed school psychologist who practiced in the 6th largest school district in North Carolina before transitioning to a state consultant role in April of 2014. She has served as a lead developer for both state and district level policies related to evaluation and identification of students with special needs, most specifically autism spectrum disorder, specific learning disabilities, and traumatic brain injury. Lynn is also responsible for coordination and maintenance of the North Carolina Registry of Approved Providers for Traumatic Brain Injury, which consists of approximately 25% of the school psychology workforce who have received special training in conducting IDEA evaluations for traumatic brain injury consideration. Lynn is an advocate of prevention and early intervention efforts and has been involved in the training development and implementation planning efforts of an instructional model for SLD evaluation and identification, as well as North Carolina's concussion monitoring policy for students who have sustained this MTBI or mild traumatic brain injury. She is also directly involved in the North Carolina School Mental Health Initiative and serves as the DPI or Department of Public Instruction liaison to the North Central Regional SMHI network. So appointments that she has includes the North Carolina Brain Injury Advisory Council, the Superintendent's Working Group on Student Health and Wellbeing, and Whole Child NC. Lynn also serves on the Executive Board and Professional Practices Committee of the North Carolina School Psychology Association. She contributes to the work of other committees such as Legislative and Public Policy and School Safety and Crisis Response. So as I mentioned, wealth of knowledge, a wonderful resource, so much experience in this field. I am so looking forward to learning more and talking more about concussion management. And Lynn, thank you so much for being here, and I'll let you take it away.
Well, thank you so much, Lauren, for having me. And I am honored to follow Dr. Karen Reuter-Rice, who presented earlier in March. I guess it was mid-March. And Dr. Karen Reuter-Rice did a fabulous job. And for those of you, as Lauren had mentioned, that have not maybe been able to hear the archive or attend live, I would definitely encourage you listening in because what she really talks about is what I won't be talking about today. She will be talking a lot about the prevalence, the mechanisms around injury, and really, the critical need. I really think that Dr. Reuter-Rice did a great job underscoring the why around what we need to be doing as a state to support all students who sustain, all kids really, children and youth, who sustain concussion. So thank you so much, Lauren. I'm so glad to have this collaboration with the Brain Injury Association of North Carolina. And hopefully, my intent today is really to talk about things that have already been established and really bring, as a person who is part of the committee of the Brain Injury Advisory Council, really try to bring improved awareness in what already exists and what we can do to help support students who may have sustained a concussion, but it also to help support prevention efforts that we need to help our children and youth be successful. So that is where I'll be starting. I'll be picking up in that. And you do have materials in the webinar materials section, and encourage you to download those. This presentation is available, and anyone who's worked with me knows that I like to put a lot of live links in my presentation so that you can have easy access in and out of materials. So many links throughout this PDF file of this presentation, and I encourage you to, I'll probably be going in and out of some of those to show you, but really pay attention to where ever you see something that looks linked or a screenshot of something, it's pretty much always going to be a live link that'll take you right to the resource that I'm talking about. First screen with my information is how to contact me, how to get in touch with me, and how to access the materials that have been created for school psychology in general. But within that website, I'll be talking a little bit about where the traumatic brain injury resources are housed, and specifically concussion resources as well. And also, if you're a social media person, please follow the School Psychology Facebook page and Twitter account as well to stay up to date. I like to put out really in the moment information across those social media networks that's relevant to the work that we do in the state. Happy to hear that we've got some diversity across different stakeholder groups with us today. As Lauren mentioned, she made me sound a lot better than I am, but one thing I do want to point out is I am really here today representing the Children and Youth Committee of the North Carolina Brain Injury Advisory Council. And this is, I really felt it was important to have a slide that gives you the information that you need, because I feel like sometimes it's hard to kind of understand the big picture of how this all works, and how we do have a legislatively mandated council, and it is supported through the traumatic brain injury team at the North Carolina Department of Health and Human Services. So I have a screenshot of the page from NCDHHS, that the traumatic brain injury page, and it's, if you don't scroll down all the way to the bottom of that page, you will miss the information that's there for you to understand the Brain Injury Advisory Council and its purpose and who is represented and appointed on that council. There's great representation, and it's in support of all things brain injury. And within that council, there are subcommittees. And I had the good fortune of being the chair of the Children and Youth Committee, along with a friend and a colleague who was a former school nurse for many years, until Dr. Karen Reuter Rice and Dr. Pete Duquette took over chairpersonship, as well as our attorney, Thomas Henson. And so we have great representation within that committee. And so I think sometimes I can get confused with, because I am a consultant within the Department of Public Instruction, and a lot of this work kind of comes out of the Department of Public Instruction around the concussion policy. However, I do want to really underscore that the Children and Youth Committee was the driving force behind all of the work that I'm going to talk about today, and in partnership with the Department of Public Instruction really made things happen. So this committee's been fabulous, and I do want to make sure that people understand that this Brain Injury Advisory Council exists to the benefit of all who have sustained TBIs, and then our subcommittee is really focused around the impact that traumatic brain injury has on our children and youth across the state of North Carolina. And so this is a live link. So this is one of those things where if you hover over the screenshot, you'll see your little finger pointer pop up. And in your PDF version, that will take you right to that page so that you can read more about the Brain Injury Advisory Council. And our meetings are held quarterly, and of course not in person right now, but they are open to the public, so anyone can attend, and they are held in Raleigh most of the time on the quarter. So I encourage you to know more about that. And it also helps make some connections between the work that the council does with the Brain Injury Association of North Carolina, who Lauren represents, because they are definitely part of that council as well. So today, we are going to just the objectives that I hope to accomplish are to really hit on the concussion information, really connect back more to what Dr. Reuter Rice referenced on the prevalence data and the mechanisms and how our children and youth sustain concussions, but really just touching back on what she's really presented in a very thorough way back in March. I want us to take a little bit of time just to look at the essential components of the education policy that was established to support our school-age children and youth who sustain concussions, and then my big kind of banner today is really waving the flag of effective communication between our healthcare providers, our caregivers, and our school staff, and ensuring that we're all on the same page with this and that we're making good decisions and understand really what we should be doing across all of those different important pieces of the work related to supporting our children and youth. So I'm really going to try to hit on bullet number 3 and be a spokesperson for getting better connections made between the resources that already exist and how we could all support in a collaborative effort this work. And I'm just, when I talk and there's no, I can't see others, I just want to make sure sound is still going well. Lauren? I'm guessing that's a yes, I hope. Everyone can hear me?
I was trying to unmute. You're good to go.
Okay, I just want to make sure. And I'm sure you'll let me know if something happens throughout the presentation, so I'll try not to stop too much. So here we are. I know Dr. Ruder-Rice used this slide as well. Our Children and Youth Committee has a package presentation, actually, that we have such a broad diversity across our very large committee of about 16 stakeholders. And we have pediatric neuropsychologists and university professors and school nurses, other nurses, school psychology is represented, as well as attorneys and emergency medical providers. So we have a kind of like across our committee, this package presentation, not this one, but a different one that we share within all of our respective networks to help raise awareness around the work that the Children and Youth Committee has done. So we have some similar slides that I'll connect back from Dr. Ruder-Rice's presentation. And this is a little bit of dated data, but it's pretty similar for this academic year, although we don't have all of the data in a published report yet for this academic year. But this is kind of the big deal around our WHO related to the education policy. Now, I'll say as a member of the Children and Youth Committee, we do really focus efforts around all children and youth across the state of North Carolina, including those that may not be in our public school systems. However, what I'm really going to be focused on today is the education policy related to over 1.5 of our children and youth that are actually in our public schools. And here you see, as of last year's data, Wake County was the largest, Hyde County was the smallest district, and you can see kind of the broad variability, the range of variability in the many counties, many traditional school districts that we have. And then at that point last year, which I know the number has grown since then, there were nearly 200 charter schools that everybody operated with different dynamics and different types of resources. But all of these students are in fact included in our public school catchment across the state of North Carolina. So I was happy to hear all of the representation that Lauren referenced in the participants, because this is, across the state, regardless of your size, regardless of the nature of your resources, something that we can all be doing to support our children and youth who have sustained concussions, and really just pay attention to what we want to do around prevention as well. So Dr. Ruder-Rice, went over this as well. So I'm not going to talk in detail, but we all have great resources and pretty much understand. And if you don't, I have a live link again here that really goes to CDC's, the Center for Disease Control and Prevention's website, that really breaks down just defining what a concussion is. It is considered a mild traumatic brain injury. And, I think the important thing for everybody to keep in mind is that it could be caused by something happening that includes a bump, blow, or jolt to your head, but it also may occur as a result of something that happens to impact on your body, because the big deal here is that the brain kind of sloshes around and could be impacted. So it doesn't necessarily have to be something that happens to your head, but affects the movement in your brain in your head as a result of any type of impact. So that's important, and they have a great little video that's also on their website that I have linked there. But understanding what it is, and I think the big thing, and I think we've done a pretty good job of this across the state, is really understanding that it's not just, oh, it's just a concussion. It really is a mild form of a traumatic brain injury. And it's really important for us to pay attention to that and be able to all be on the same page in recognizing that this is not just a minor thing. It is mild, but it could lead to other potential problems if we don't take care of it, especially for those that are, prevention is key. However, we also have a need to pay really close attention to reoccurrence and doing everything we can to prevent once a concussion has already happened in a child. So she really did go into detail around that, but we do have, I wanted to make sure that you have access to, and I'm sure many of you on the webinar do, the resources that are there that give us really good information and break things down really easily. One thing our Children and Youth Committee really stressed in partnering with the Department of Public Instruction and in looking at the State Board of Education policy that was approved way back in 2015, is really paying attention to the fact that the approach to care is individualized. As Dr. Reuter-Rice said last month, if you've seen one concussion, you've seen one concussion. That there's variability in how we recover, how our children and youth will recover from a concussion if they sustain it. And it's very dependent on the fact that although we recognize that most concussions will resolve in a matter of a few weeks, if we do what we need to do to help support the recovery process as the adults in our children and youth lives. They can't do this on their own. They can't pay attention to what they need to do on their own because many of the things that they need to do are altering the way that they typically function for a little while. We know it's a hidden kind of injury because you can't put a bandage around your brain and everybody sees it, like when you hurt other parts of your body. So it's really difficult to get our children and youth to pay attention to those things and be intentional about the recovery piece. And also it's really easy to mistake, as Lauren mentioned, these injuries for other types of things. So we do want to understand, although there is an individualized approach, there are some key things that we want to pay attention to in the recovery, and recognizing that the majority of these children and youth, if we do things well and things go as they should, the majority of symptoms will resolve within a few weeks. So this is a very short-term, rapid response kind of way that we need to to support children and youth needs when this happens. This isn't a long marathon that we should be in. We should really have teams established and communication systems in place so that there could be a quick response, monitoring, management, and hopefully recovery and out the door for most of our kids. There's lots of different ways that we would approach cognitive rest depending on what the level of impact is for that individual and other types of variables. So I'm not going to go into lots of details, but I'm going to point you to some resources that I hope that you're either utilizing or will utilize. And then one thing around the care approach is that, another thing around the care approach is that we have to pay attention, and this is really relevant to a lot of the work that I do because I do a lot of work very specific to the needs of students with disabilities and typically, have some pre-existing conditions. But generally speaking, if there are any types of pre-existing conditions, we might see an extension of the symptoms and recovery. And we also, depending on the nature of the pre-existing condition, we have to pay attention to whether or not that student, that child, is at higher risk for reoccurrence as a result, and what additional protections might we need to consider for that student, because they may be in a higher risk for reoccurrence as well. A link that you have on this slide as well is a really nice pediatric guideline for concussions that the Centers for Disease Control and Prevention released. I believe it was in maybe September of 2018. It wasn't that long ago. And it is live linked there, and it does provide some really good recommendations and information that really complement what we had already established in some of our resources and materials, because the state policy here in North Carolina was approved well before this guideline was established. And there's lots of great materials that are very complementary to some of the information that's already been produced on this topic. So I would encourage you to take some time to review that and understand that it exists, and is a really nice recent publication. So keeping in mind who we're talking about, our children and youth in North Carolina, and the why, which again, Dr. Ruder-Rice underscored really well. This is a public health and education concern, and it's pervasive across all of our children and youth, and the prevalence data really speaks to that. And the prevalence data we have is what we know. There are many concussions that are happening that we don't end up learning about, and so one of the things that the policy that I'll get to in a minute really tried to pay attention to was really trying to increase and ramp up our efforts in the public schools, at least, around our surveillance on this, and to get better to accuracy in the data that we have on concussion. But what we know is that they are highly prevalent, even knowing that we're missing a lot of kids in terms of the numbers that we have at the national level and state, because many of them will go undiagnosed. There is an impact, and there can be a significant impact on school functioning, but there is, even in the short term, some level of impact typically on school functioning, that all of those that are involved with the student, our caregivers, our parents, those that are the professionals in the schools that know the most about this work, our school nurses, our medical go-to people in the schools, they can assist and really have been really assisting with the work around this because of the health piece of it, the physical health piece. Also, there are other professionals in the building that can help with this to help understand what the level of impact might be on school functioning and be able to support that, whether it's minimal or it becomes more problematic. But really understanding the problem and the root cause is important, and that goes back to having a better system of surveillance in place around this. So we actually are paying attention to the right problem when we have students who have symptoms that we don't want to mistake for something else. This was the other piece of, that I said, we tried to put some work and effort through the Children and Youth Committee in partnership with the Department of Public Instruction to really figure out how can we get better with our managing and monitoring of this condition. So this is a why. What really drove the work about 5 years ago or so, a little less than 5 years ago. So I won't go into details, but this just kind of captures some of the reference points that Dr. Ruder-Rice made in March around the prevalence. It is the most common type of mild brain injury. You can see some data that came from the Centers for Disease Control report. I believe it's a 2018 report in the management of traumatic brain injury in children. There's a little screenshot of one of the graphics in that report that I believe was in Dr. Ruder-Rice's presentation as well. What we know is that 70 to 90% of emergency department visits are caused, the mechanism, what what is happening in 70 to 90% of those cases is a mild brain injury when we're looking at the types of brain injury that are coming out of what we have in terms of emergency department visits. And then at the national level, of those, there is some studies that have been done specifically around children seeking emergency medical care. And this is, again, this is just looking at the emergency department data, really all of the other places that children may go as a result of an injury that they may receive. So, the majority of these, as you can see, drastically had a concussion in comparison to other types of moderate to severe brain injury. So this is a pretty big deal, and it happens a lot, even when we know that there are many cases that we don't have in these data reflected. We need to take them seriously, of course. Reason why we're talking about it. And I have seen that. I really do think that we have paid closer attention and gotten away just anecdotally from conversations around it's just a concussion to it's a concussion. And we need to pay attention to what we know we need to do about it. And I think that it definitely is something that we've seen over the past at least 5 years. And my kind of anecdotes around the state that we've paid closer attention to this in our children and youth across all aspects, not just in our public schools, but any of you who have kids who play any type of sport, recognize that at the younger ages that this is something that our county-led sports associations and club-type associations are paying close attention to as well. And that link just goes back to some of the CDC's information. So the why also was the Children and Youth Committee really saw that in July of 2011, and this was well before I was part of that committee, the Gefeller-Waller Concussion Awareness Act was actually legislated. I'm sorry, I might have said July. It was June of 2011. So at that time when the Children and Youth Committee was really looking at concussion and our children and youth, we saw that, okay, there are protections in place. However, the protections that existed in the time that they were looking at this around 2014 was really, it was related to student athletes only. And we thought, well, there's definitely a large group of kids that are not, being monitored really effectively, or if they are, we don't know about it because we really don't have anything that tells us what are we doing for all kids in this state. And so that's kind of what was a reflection point for the Children and Youth Committee on making a decision around, do we need to do more work around concussion, or do we already have the right protections in place? So the Gefeller-Waller Concussion Awareness Act certainly did a great job of covering areas like on this table that you see, is protecting student athletes within the realm of a school-related sports activity. So again, it was limited in scope to school-related and student athletes. It does actually have education components for coaches and nurses and volunteers and student athletes and parents as part of the act that was legislated about 9 years ago. And there's an emergency action plan component to it, as well as what types of criteria need to be met in order for that student athlete to return to play. So although the Children and Youth Committee recognized the things that you see on the right that were not addressed by the Gefeller-Waller Concussion Awareness Act, it really provided a great foundation for just building the missing pieces in for all students in our North Carolina public schools, regardless of the mechanism of injury. How can we support them? Although those 4 areas were gaps that were identified that you see on the right, the act itself provided a really strong foundation, and where the school nurses and others listed here that already had some preliminary knowledge of how they handle student athletes was easily, or could be, or should be easily translated for all students, because it was very similar and a really strong foundational piece to the work. So this was kind of on the right-hand side, all of the focus areas that the Children and Youth Committee focused on in working collaboratively with the Department of Public Instruction. And so it landed on kind of what was this education policy. And it was approved by the State Board of Education. And I believe right here, you do have a live link that should take you right into the State Board of Ed's policy manual that references the policy. Again, we're almost 5 years into approval. However, the State Board in their approval in September of 2015 allowed for implementation to begin at the next academic year, which would be July 1 of 2016. So that was the actual implementation effective date, was the 16-17 school year. So now we're 4 years, almost 4 complete years into implementation of that policy, and I'll talk to you a little bit about the data that we have around that, and part of the reason why I'm really trying to focus the rest of my time today on the big idea awareness campaign and connecting all the dots across those that are involved between community providers, our parents and caregivers, and our school staff to help all get on the same page and just put in the necessary components at the local level to support our students and kind of get to better outcomes for our students. So that's kind of where we landed. And 16-17, although this is a September 2015 approval date, this July 1-16 was the implementation date for the policy. So I'll spend the rest of my probably 15 or 20 minutes here talking about some of the key components and some of the resources that are available to all in the state, and also some things that are in the works. And then we'll leave some opportunities for questions and that hopefully I can, engage in a little bi-directional communication here during this webinar and answer a couple questions or at least give some input before we close up. Essentially, this is what the policy says. There are 4 major components to its coded student health. So at SHLT-001 is the actual policy reference. And so the big components that the Children and Youth Committee worked on with the Department of Public Instruction to present to the State Board of Ed were really like every local system needs a plan. And there are some key elements that need to be included in that plan. As part of that plan, there needs to be a team that can work at the building level to be able, again, this is rapid response, right? So although this is a response type policy, because a student will have to have an event happen in order for us to respond, right? So, it is kind of reactive in a way because the concussion happened already. However, the Children and Youth Committee really looked at it as a prevention model as well, to really have those local boots on the ground be able to collectively gather quickly, nothing fancy, but just understand that this event occurred with this student and be able to generate, hopefully in most cases, a short-term plan of action, right, for each of those students. And again, going back to the care approach, it's individualized. So it's not going to be a one-size-fits-all for every student. However, we do know some things around concussion symptoms that we could use as our anchoring pieces for how school teams would then implement the plan. And then the other piece to that, which again, those of you that understand Gefeller-Waller have worked for 9 years with Gefeller-Waller for student athletes know that there's staff development that would occur just in making sure every relevant staff member understands general information on concussion. And then the system of surveillance was a big deal as well. to have what could we do to better account and have a better count of what our actual true numbers look like. And there's lots of work that can always continue to be done around that part D for sure. So those are like the big buckets. So I'm just going to talk about them really quickly, and then I'm going to point you to some resources that if you're not already using, I would certainly encourage you to spend some time in. So develop a plan is kind of the beefiest piece of the policy. And I'm glad that there are other stakeholders on this call, because I think it's really important for those of you that are school professionals listening in. The big deal here is that we need to have our, wherever you are and whatever local system you're operating, this policy and the understanding of the policy needs to be understood by the medical providers, the healthcare providers who are actually making the diagnosis. So they're the people talking to the parents at that first point, and be able to provide that parent and caregiver with good communication around, okay, this is what I'm going to recommend, and understand that this is kind of what the public schools are already supposed to be or wanting to do around this. And then the parent be able to come back to the school and articulate clearly kind of what happened with their student, provide the right documentation and information around that, and know better what to expect, so that we can all communicate and do what we want to do, is get these kids to recovery quickly and not miss any kids, right? So the plan is a big deal because it does have 4 components, and typically the plan, a local system ideally would have a large, like a district level team that comes up with this plan, right? So what do our guidelines need to look like for our local system? As I referenced, you saw the map of the state, you saw the numbers, very large to very small, and everything in between in terms of our public school systems and entities. So every local system is going to have a little bit of variation in what their resources look like to be able to implement this plan. But ideally, this A would be created by a team at the system level, that then every school, every building in your system would know how to apply this plan. What are the guidelines? How do we notify that the student's been removed, right? Or sustained a concussion and needs some sort of medical care plan and or educational care plan with potential, depending on the severity, and other types of individualized variables, like what does school need to look like for this child in their recovery? And then what are those criteria that get this kid back to what they were doing prior to the event, the concussion? So what do we need to see? And it's largely around symptoms, and it's largely related to how are we going to monitor this student's progress, so that when we see that they are back to pre-event functioning, we can then release them from this plan and from the removal of certain types of restrictions or activities. And there might be academic types of restrictions or activities, and there's always, if they're involved in any kind of sports, that return to play should come logically after, the education piece has been cleared really effectively and all other things look normal with this student, because we certainly don't want to set them up for any significant reoccurrence risk. Or, Karen Reuter Rice in her presentation on, she referenced a very, stark example of what that could look like if we don't make sure that a student is restricted from certain activities until we know that they're symptom free. And reoccurrence can lead to death in some of our kids, and that is not the norm, but we certainly don't ever want that to happen with any of our children and youth. So those are the big, like that plan is like the big kind of like chunk of the work, and it really is just like what do these 4 components look like within our system? And then it's more about, okay, then establishing across every building within our system how this works and how we can be consistent with it. And that comes with the right team of professionals working together. And again, some of these, so who's the team in each school? That's something to think about. And it has to be a team that could effectively communicate and respond pretty rapidly. And again, we don't have to get into lots of high-level formalized procedures. We just really need to be able to have a team to be able to interact and respond by developing those key components around notification, how we're going to monitor and support, and then what are the criteria established to move this kid out of this kind of period of concussion monitoring, management, and support when they get back to full recovery. So some of these ideas around who the team would be are constants in a building, like the student's parent, who's not in the building all the time, but the student's parent or caregiver is with that student majority of their time outside of school. A building level administrator, a school nurse may have multiple schools, but the hope is that, they're present in the building as frequently as possible. We all know that our school nurses and our school psychologists and people like that who have to serve many buildings are not necessarily there every day, but they are definitely critical roles that you would want to consider as part of the team. And there's always ways that we can communicate remotely and effectively. And we're learning that, aren't we, through this pandemic, that even if somebody's not there every single day, there's ways that you can all communicate and create a good structure, recognizing that you want the right people as part of the team. And of course, the school counselors typically are more present on a regular basis in the buildings on a daily basis. So they would certainly be role types to consider. So these are just suggestions. They are not mandates, but they're just kind of suggestions around who that team would be that implements that larger plan that the district might have should have created in A to be translated down to the building level. C is to provide annual education for staff. So that's just something that even at the beginning, and we're in the process of revising that, but at the beginning, we offered up at the state level, the Children and Youth Committee, in collaboration with DPI, packaged a recording available on the Concussion website that schools can take and use to provide annual staff education on concussion. Lots of local systems did their own kind of archive that happens on a regular cycle, kind of like other trainings that school staff need to have. On a regular cycle, usually at the beginning of the school year, and they have a window of time to complete it. So that's the kind of thing that C captures. This is probably the easiest thing, the easiest component of policy that most local systems were able to kind of establish and have created pretty quickly. And that kind of takes care of C. And then the D was the surveillance component. And it's really just how the district determines, in A, at the district level teaming structure, how are they determining that we're going to do a better job surveilling, right, our students who have sustained a concussion or may have, and we may or may not know about it. The diagnoses that come in from the parent during the course of the school year are one way that information comes in. However, some local systems have provided ideas around in annual student collection. A lot of those things, if you're a parent of students in the public school system, like I do, that there's a bunch of information that you have to fill out or complete at the beginning of the school year. Emergency contact information, who does the school contact in the event of emergency with my child? In that kind of regular annual collection, many local systems have used that opportunity to insert a question related to head injury or more specifically concussion. And that is a way that they've ramped up their surveillance. And then they have a system that's established at the building level for when those come in and we account for them, then you kind of cross-reference that with the students you know versus the students you had no idea that they sustained a head injury or a concussion. And then there's a system within that professionals for the follow-up that might need to occur. And there may not be anything that needs to be done with that student at that point, but there's a plan for follow-up. So it's a little bit more than just collecting data. It's actually doing something with the data that you collect that helps with the protection piece for all students. So that in a nutshell kind of breaks down the 4 essential components of the policy. And again, this is kind of just a visual representation of what was approved and to be implemented in 16-17 school year. And so there's always a cycle, a continuous cycle of improvement around anything that we're doing for kids. And this is a really good opportunity. And so I appreciate that Lauren invited some of us from the Children and Youth Committee to be a part of the concussion series, because I think it's a really good opportunity in this remote kind of space that we're in for school teams from the district to the building level to really do some review and revision around their cycle of around different types of things that they have in place, and this would certainly be one of them. And I think it's a really good opportunity to, in this understanding the how are we doing with our plan, what types of teams are established, what types of annual staff education are we providing, do we need any tweaking to it, kind of what we're doing too in many state level aspects. And then, you know, what's our system of surveillance looking like? And are we doing a good job with collecting data, but then nobody's really doing much with that data? How can we kind of fill in some of those gaps? And I think one of the big pieces is the communication and awareness side of things. And do our parents understand this? Do our parents know that we've got this that we're doing to support all of our students, not just our student athletes? Do our community providers, who are considered healthcare providers, not just our emergency management folks, but our folks that are general physicians, that are seeing our kids, that are urgent care type settings. This is where the Children and Youth Committee, and in collaboration with other resources such as the Brain Injury Association of North Carolina, we can try to get SEEP resources out there into the local communities, but really the local people in the communities are critical to that effort. So I think it's something to really think about for those of you that are on today, and think about what can we do in this time that we have. We have a lot of other things going on, but this is a place, this is a time, a really good time of year to really look at this policy, the implementation of it, and determine what's our continuous improvement cycle around implementation. So as we get to the 1 o'clock hour, I'm going to wrap up in a few minutes by pointing you to some resources, and in hopes that you're either utilizing them, sharing them, or if you aren't aware of them, you'll begin spending some time in them. The one thing, and actually I'll say, in this place that we're in with remote work and functioning, we are in process right now of doing some reviewing to the Return to Learn implementation guide. So this guide, I gave you big buckets of the policy. The guide itself was established, and it's reviewed and revised every 1 to 2 years. It's about 1.5 years, so it's time to review it. It's a good time to review it. So hopefully you can see I went right into the space where it lives. And we had the good fortune of having some local systems that you'll see here collaborate and share some of their resources. And through this, I hit on the big buckets, but each component of the policy, each of those 4 components are explained, and then there's some examples. Now, I gave you some anecdotes, but there's some actual specific examples, and if there's relevant tools or resources that may show you what this may even look like, they may be linked there. Now, know that we are in process of updating this manual right now, so there may be some things that will change, and we will certainly communicate when the update is ready. There may be some links that no longer work, so that's our whole process of reviewing and revising. But I did want to share that these things, those big buckets that I referenced, there are explanations, examples, and resources that are provided for each section. Some have been provided by some of our local systems that were interested in contributing when the policy was approved and when the actual original version of the implementation guide was being established. So that's one resource that I wanted to make sure that you were aware of. And again, knowing it will be kind of updated. So this is also an opportunity for those of you in local systems that are on the call. If you have something that you would like to share that you think is really good and has worked really well within your system, please feel free to contact me. As you saw in the beginning slide, there's lots of ways to get in touch with me. I am happy to be the conduit of sharing this information. It goes through a review process with our Children and Youth Committee, and it goes through a review process of the Department of Public Instruction. And we can definitely consider any additional resources that local implementers want to share and contribute as part of this guide. Really, it is there just to be a support and an additional resource for systems to think about their implementation. Another thing, this kind of hits on, and this is all on the concussion page of the website that I manage, but I also put it here for your easy reference. I had the opportunity to work with Dr. Pete Duquette, who's a pediatric neuropsychologist, also part of the Children and Youth Committee. He collaborated with me last summer and provided a really nice school-based interventions webinar. It's about an hour and 15 minutes long. You can go right to it from these slides and listen to it. There's some real practical around intervention and support, and also some references to some of the things that we need to pay attention to around student symptom monitoring and the progress monitoring piece. So I have the slides and the note-taking handout and the presentation itself linked right here. Again, it's also in the concussion site, but easy reference here. So I think that goes into some good details too about approaches to supporting students through the intervention lens and the progress monitoring lens as well. And I'll talk a little bit about our outcome data and the reason why I really want to focus on bringing awareness to some of these things. So our school nurses collect so much great data and report it at the state level every year. And through our state school health nursing consultant, Ann Nichols, she is able to provide and point me to the concussion specific data so that we can look at how things are going based on the school nurse reporting. And so this slide has a couple points that I want to make. So this slide lays out pre-policy, which is the 2015-16 school year. That was before the policy was approved and to be implemented. And then it gives us our past 3 years of data based on school nurse reporting around concussion and the implementation of the policy. But this is more about numbers, counting our students. And so this is, of course, limited to those that the school nurse has had an interaction with. So that's why it's critical that going back to that B part of the policy, having the right team of professionals involved and figuring out ways to be involved and efficient in communicating and everybody knowing who the numbers are. And I think it's really critical for school nurses to know too, because they are the only source we have right now of how we get state level data reported up. There's no other mechanism that we have to rely on for that right now. So we appreciate that. But one thing I want to illustrate is that from pre-policy in the blue bar to the gray bar, which was last school year, not this I'm sorry, it's not this current school year. It's the 17-18 school year. So 2 years of implementation. So 16-17 and 17-18. 2 years of implementation of the policy resulted in huge increases of the counts. Still very much underrepresenting what we think we know based on research on concussion prevalence, but still from 412 elementary school students to 794 in 2 years' time was a 93% increase in identification. That's great. That was moving in the right direction. Same thing with our middle school. You saw a 94% increase in 2 years of implementation. And then also in high school, the numbers started out a little higher, largely probably due to Gefeller-Waller that was already in place. But they bumped up 76% increase from beginning of implementation to 2 years in. That was all moving really nicely. Of course, you know, it's more kids, but we expect that because we already knew that we were missing a lot of kids. So last year's data that we saw a real plateauing and even a bit of a decline in the identification numbers. Now, there's several hypotheses around why that may have happened. One is the optimistic one, which is everybody's doing a really great job and we're preventing a lot and we're seeing less kids and being injured. I would love for that to be the case. We just don't know that it is. What I know about implementation of anything is that it usually doesn't level off that quickly and that we see a surge a little bit longer. So this is just me talking from a hypothetical, hypothesis-driven place. But what you can see in the yellow bar from last school year's data is that that surge kind of stopped. And so again, I think this is where the Children and Youth Committee really looked at these data and they said, well, what can we do as a committee to improve the awareness, to kind of re-spark if this stop in the surge is really due to the fact that things kind of fell off maybe around it. Who knows? We don't know. I would love for it to be that we're doing a great job and we just don't have that many kids sustaining a concussion, but our research at the national level tells us that we have a lot more kids than this sustaining a concussion in our children and youth. So I think it's just a really good opportunity to think about the data, look at our state aggregate data that we have through the benefit of the school nurses reporting, and think about in your local system how that might look, and maybe pay attention to what your local systems are saying about your concussion prevalence data. What our Children and Youth Committee has done is we think that we want to take the opportunity to continue this work and really focus on awareness and getting resources and materials into everybody's hands as much as possible, not just our school staff, but our parents and our caregivers and our healthcare providers. And so that everybody's kind of speaking the same language around children and youth who sustain concussion. And it wouldn't necessarily be a bad thing if this year's data, the 19-20 data, showed another surge, because what it would at least tell us is that we're doing a really strong, we're strengthening our surveillance data, and we would expect to see the numbers continue to climb for at least a handful of years around this. So that's some data that I wanted to share, and we appreciate having access to it. And just to have you think about and then apply, these trends to your local systems if you're operating in a local system, a local public school system, and kind of think of what do those numbers look like in your local system compared to the state level data. So I'll wrap up by, again, continuing the awareness around this work. And you have some live links there that go right into, this is a link, and then this is actually a link right to the same place. But you can go to obtain some of these materials that I've already referenced right in the school psychology concussion page, which it has moved in the past several months. So if you had old links to this information, I would encourage you to kind of look at your links and make sure that you have the most updated links. This is where we'll continue to build at the Department of Public Instruction. This is kind of the place where things are housed around traumatic brain injury and concussion. So this takes you right to the concussion page, but when you go to traumatic brain injury, you go under TBI resources, and then you can click on concussion information and resources, and it gives you just information around the policy. It goes right to the Return to Learn implementation guide that we'll be updating, and it also takes you to the other awareness information and activities that the Children and Youth Committees are working on over the past couple years. And it also takes you to that old webinar and the one that I referenced with Dr. Duquette. So lots of, and then relevant links to additional information and resources you can see there. And hopefully everybody's seeing my screen. Hold it up. So this is where kind of all the concussion information is hubbed at this point that aligns with that State Board of Ed issued policy. So make note of that if you had old links, because they have changed a little bit. And the last is this big thing from the children and youth that we've worked on for the past several years, but have a really great partnership with the North Carolina Department of Health and Human Services TBI team. And so our committee, in collaboration with the TBI team, who supported the funding for these communication resources and awareness resources. One of them looks familiar to many of you because it is our information brochure that we've established for parents and providers, and to be a visible thing that exists within your local systems to give parents information around what our schools are doing actually to support this work. We have English and Spanish versions available, but the exciting part is we have this request process where systems can request brochures and get them for essentially free. We may have to, there may have to be some shipping kind of charges associated with it, depending on how big the bulk is. But typically you can, you have a link here that any stakeholder really, any provider, anyone who touches children and youth and needs to pay attention to this can order some of these materials, and they are not at any cost except for possibly some shipping charges. And we have enhanced them. The Children and Youth Committee has done some revising to this brochure, so it is a trifold. But what we've added was a really nice feature on the back panel, which is, this is the wrong version, I see, but the back panel of it actually has a parent checklist that is given to the to be used as a tool for the parent. So if they pick up these, if they see them in the school, or if they see them in the doctor's office, or they see them anywhere else out in the community, they can know kind of what North Carolina's efforts have been through the Children and Youth Committee and what the school policy is in a nutshell. And then they can use this back panel as kind of like, okay, who's the concussion contact at my school? Did I provide them with the right work? Am I sharing ongoing information with the relevant folks within my building level team around my child's symptoms? And then am I making sure that I'm providing the right follow-up information to the right healthcare provider, from the healthcare provider to the right school personnel, which is often our medical professionals in the school, which are nurses. And so it gives them a nice little checklist. So we have updated and provided some enhancements to that. And the other thing that we've done in the Children and Youth Committee is we've created a poster that is a 24 by 36 inch poster that you can actually request through this process that I'm pulling up on the screen. And again, it's not just for schools, any doctor's office, any community entity that wants to bring awareness around concussion. This is a really good place to start, because it gives you a really nice visible resource that you can place in view of everyone, that provides you with some information on concussion and our children and youth and our actual state specific information. and provides some information to some additional resources. So this is, again, a part of the Children and Youth Awareness campaign around bringing more resources in and making sure that across our state, everybody's aware of some of the resources that we have available to you all. And I am going to stop at 1:15, and I'm going to allow, if anyone has any questions, comments, anything we can spend the last 15 minutes with. I'm happy to spend that time answering any questions, but I do thank you for your time and attention. Hope that this information was helpful, and hope that you will definitely get in and utilize and share and order some of the resources that are available to support this effort across our state.
Wonderful. Thank you so much. We're getting a lot of thanks in the comments. Feel free to use that chat function right now to ask any additional questions that you might have. You should be able to download the handouts, the slides under the handouts function of the GoToWebinar. If you do not see them, if you can't access them, just give us an email. I can email them directly to you. About at least at most a week after the webinars, they'll actually be posted on our website as well for you to download, so if you don't see them immediately. If you need a specific certificate related to the contact hours, contact webinar at bianc.net. And it basically, you can just reply to the email that comes an hour after this is finished, and I will get that specific one with your name and contact hours to you. So one question that we have is, have school districts typically done the outreach to medical staff to share info, for example, providing a referral type form to let the school know the child has sustained a concussion?
At the state level, I have heard anecdotally in interactions with some school folks, we don't have a way to really know what's happening across every local system in the state, but I do know that some systems have definitely done that proactive side of things. If there's a way that they want to capture information in a consistent way around their students, they might have established like a local form that they've provided. However, sometimes what happens is, you know, concussions happen and parents go to the doctor and they don't go to the school to grab a document, right, to get it filled out. But they can certainly, when they come back and report back to the school, sign any relevant releases of information, and that information get captured in that locally driven way. Sure, and I know that some systems have done that. If that answers the question.
Excellent. One question we have is whether or not this webinar will be made accessible to those with hearing issues via captioning at any time in the future. Right now, the live sessions, we're not looking at providing that service, but all of our recorded webinars, actually, we generate a transcript with them, which means they won't necessarily be exactly on point as it's a electronically, you know, automated system. But those, when you look at the recordings, you should be able to access the transcript as well. So hopefully that provides some accessibility options for individuals. So one question, so what do you see as, you know, North Carolina, the return to learn, you put in a very nice, nice package here. Do you see particular like weaknesses or somewhere where you would like to see return to learn and concussion management go in the next like 5 to 10 years? Any wish list items?
You're asking me on behalf of the Children and Youth Committee?
Yeah.
On behalf of the Children and Youth Committee, I think what we would like to know, you know, that the resources are being utilized and that it's actually bringing about prevention efforts, right? However, what we expect that we would see across our state is a continued surge in identification. So that doesn't necessarily, it's not necessarily a bad thing if we have continued surges in identification, because we already know that we're under identifying. And so I think I think our Children and Youth Committee is really hung up on the system of surveillance piece, and knowing that, you know, we could probably get closer to accuracy in the prevalence rates. And once we have a handle on the prevalence rates, I think that that's really the first step. Our Children and Youth Committee tends to agree. It's the first step in really doing the things that we kind of describe and I pointed to in terms of support, management, monitoring, because if we don't know who these kids are, we're going to miss a lot of kids, and we may be misidentifying problems that are more related to a concussion, but we might be attributing them to something else. So we really want to get it right, and we want to be able to help support systems in getting it right and having accurate kind of like ways to identify so that they can take those steps to do those things to help catch, manage, monitor, release most of those kids back to normal in very short periods of time.
Excellent, excellent. One comment that we have is, that their school doesn't necessarily have a school nurse. Who really should take the lead on efforts such as this? This is an athletic director that deals with all the sports related issues, and they're kind of looking to figure out who should be the lead.
Yeah, I think, and that's why it has to, as you see this on this last slide, you can see that the state is big. We've got lots of kids in our state, and we know that within this policy, it's over 1.5 million, and every system is so different depending on like what their resources are. So that's why like the at the state level or Children and Youth Committee, like we can't dictate the who. However, I think finding, having people who there is someone or some entity that collectively oversees student health, right? And so who are those folks? And how can they connect with those that are like, education professionals and medical, behavioral kinds of support people, because we know that there's some symptoms that are related to behavioral, issues with concussion. So I think it's just like, it's not necessarily defining the role type. If you don't have any of the roles listed, in the presentation earlier, I think it's more about like, all right, who's kind of overseeing this, and then how do we get like the right kind of people that connect into this, even if their role isn't defined as it's listed, like on the generally speaking like recommendations. Athletic trainers, I think you said, or coaches, certainly should be part of a collective team, but they aren't necessarily dealing with the entire student population in all cases. And this is about all students. So this is your kindergarten kid on the playground, right? This is any elementary age student, which typically, your organized school sports aren't beginning until like in often cases, upper middle school into high school. So I definitely think that like coaches and athletic kind of trainer types are certainly key roles, but to lead the effort would be, they would have to have the lens that would be applied to all students. So who is that has that lens over all students? Because this policy is where we've kind of closed, or at least tried to cover up some of those gaps that Gefeller-Waller legislation didn't reach down far enough into every single student, right? Every single child who may sustain a concussion. So I think it's really thinking, who are those folks, and how can we get a team together to create a good plan that all of our buildings can actually implement, and realistically, because it should be short-term, rapid response, catch and release types of things. So you have to be able to communicate effectively, quickly, and be able to kind of have a good protocol in place so that it could hopefully get those kids back to normalcy and release them right back out.
Excellent. Thank you so much. And I've got a little bit of construction behind me, so hopefully you can't hear the noises of beeping. But so we have another question. So this, presentation all reflects a great effort to address the needs for students with traumatic brain injury or TBI issues. Is there any effort to expand the scope of these brain injuries to be more inclusive to students with ABI or acquired brain injury, such as strokes as well?
Oh, that sounds like it was like set up just for another thing that I forgot to mention. Another resource that we have available, you cannot see it on the TBI site yet. We have a TBI online curriculum that is free to the public. As I know, BIANC has similar types of resources. But we do have an online curriculum for it serves a couple purposes. It's used as the point of entry for school psychologists that want to undergo the training to become school psychologists who can evaluate students for traumatic brain injury who may need special education. But it also serves the public. It's in the public domain. Again, you can't see it right now because it is being updated and enhanced, and hopefully will be published by either Friday or Monday, this Friday or Monday of next week. And it does address the broader kind of understanding. Now, there are some very technical pieces to that curriculum that go deeper to meet the training requirement for school psychologists, but it does actually hit on all brain injury and really goes into different types of mechanisms and levels of severity. So that is one resource that I would encourage you to look for in the public domain within the next week or so through the TBI page on the school psychology website. And then also in that website, and it definitely could be a foundational element to some more work that we can do for more moderate to severe types of traumatic brain injury for sure. So we could see if we need to go deeper beyond the curriculum for some additional kinds of layers of professional learning such as this that are, smaller chunks of time than the curriculum takes.
So we'll take about 2 more questions. If you have additional questions, we'll be sure to get the answers and maybe send them out. But we have a question about with North Carolina having some of the country's largest military bases, which have schools that are not managed by the North Carolina Department of Public Instruction or following IDEA, since they're all under the Department of Defense. What efforts, if any, are there in place to coordinate identification and services to these students living with brain injury?
Right. So I think that's a really great question. And I think that from the Children and Youth Committee's perspective and the Brain Injury Advisory Council as the larger entity that supports our work, I would definitely say that is the vehicle through which. And although this is kind of for this children and youth subgroup specific to concussion, the work that the Children and Youth Committee has done in partnership with DPI doesn't have to just be for students within our public school systems. We wish and hope that private schools and other types of academic types of structures across our state would take this information and incorporate it into their existing system. So it doesn't have to just be applied there. It could be translated and utilized and used to support students, children and youth across who are school age across the entire state, regardless of what type of entity they're receiving their schooling through. And then also I think that the vehicle, so that's children and youth specific, and it's very specific to concussion. I think that the Children and Youth Committee and the larger Brain Injury Advisory Council, and also the resource that you represent, Lauren, are great ways that we can continue conversations and pull stakeholders in to be able to contribute to how do we broaden this for all. And the council itself is there for all people who sustain TBIs. And so I think that's the vehicle through which we would want to look to expand some of these efforts.
Excellent. And if I can just sneak in one more question. So this individual is currently completing our research as part of a master's project to highlight the role of school-based speech language pathologists, or SLPs, within these type of teams. Are there plans to include SLPs as team personnel in the future on the Return to Learn guidelines, or have SLPs reached out with questions regarding their role in this protocol?
I haven't specifically received any questions, but I think what you're referring to is the team of professionals in that question. And that was not intended to be an exhaustive list. And certainly any provider that is relevant and could contribute to this work as an appropriate team member should be included. And that could certainly be a recommendation that comes with our updates to the implementation guide as well, if there's information and resources that point directly to any other provider type being part of those teams. But it was not intended to be an exhaustive list and can certainly include and should when available. We have not received I haven't received a lot of questions related to speech language pathologists' role in this, but that doesn't mean that it hasn't been brought up before.
Excellent. Thank you so much. I think that's all the time we have. It's all the questions we have. So we got to them all. It really sounds like there's a lot that's coming down the pipeline in terms of education that you guys are providing in terms of concussion, but then there's also a lot of already created materials and information that people can access on the North Carolina School Psychology website. And so with that, I just thank you. It sounds like there's a lot of exciting things. And if anyone has additional questions, needs that certificate, needs the handouts directly, you can email webinar@bianc.net. You should see the recording in your follow-up email, but then also it's going to be available on our website, and you're able to download the slides there as well. Within the next week or so, I'll have that uploaded. So other than that, I just thank you all. Stay safe, stay sane, and I really appreciate it. And I hope you have a wonderful day. Thank you so much, Lynn.
Thank you so much for having me. Take care, everyone.